Welcome to the Functional Nurse Podcast, where we explore how nurses are transforming healthcare through functional medicine and nurse-led innovation. I'm your host, Bridget Sager, founder of the Institute for Functional Nursing. Here, we're reclaiming our role as healers and leaders, one root cause conversation at a time.
Hi, everyone. Welcome back to the Functional Nurse Podcast. My name is Samantha Hamilton. I'm the Director of Growth and Partnerships here at the Institute for Functional Nursing. And I have Jessica here with us today. She is one of our students within the Functional Nursing program. And Jessica's been in healthcare for 12 years, starting as a corpsman in the Navy, specializing in surgical technology. After separating from the service, she gained her bachelor's in nursing from George Washington University, and she's currently an ER nurse and a student within our functional nurse program, but she also recently started working in a primary care functional nurse role. So I'm just excited to introduce her and hear really her experience about how she's using functional medicine in both the Western medicine world, how she ended up getting a job in a functional medicine clinic, because this is something that a lot of potential students ask me is, where can I use this knowledge even though I'm currently working in Western medicine? So Jessica, can you just give us a quick, intro into how you found functional nursing?
Yeah, oddly enough, I was listening to a podcast and then just seeing people that I know on social media talking about raw milk. And I don't know how it worked that my whole journey started with raw milk, but I just kept seeing it and I was like, what is this deal with raw milk and why is everybody drinking raw milk? And so just learning about that opened the door for me. And so I just started paying more attention. And then it was like a snowball effect. This past year, or like the end of last year, that I decided that I really wanted to take my career in this direction. And so I started looking at different programs, and I knew a naturopathic doctor in my area. And so I met with her and had coffee and just asked her about her journey and how she got started. And I had listened to an episode of the podcast before, but then kind of forgot all about it. And you know how the algorithm works. So then all of IFN stuff started popping up in my algorithm. And I started looking into it and just comparing it to the other programs and seeing that it gave me like a course breakdown. So I kind of knew what I was getting into and what was being offered. And then the partnership with IFM also was important to me just because I think IFM is so well known and trusted in the functional medicine realm. And so that gave me confidence to do this program.
What do you think so far? Both Jessica and I are in cohort 1. We just wrapped up our first semester and we're kind of in our break period right now. I'd love to hear, how are you using this in the ER, but then what triggered you to move on to trying to also find a job in a functional medicine clinic?
Yeah. So using it in the ER has been both a challenge, but also empowering because I think it gives you like tools outside of the box to actually give your patients tangible ways to make lifestyle changes. I see so many patients in the ER who are seen for the same issues over and over again, and they're kind of doing the same things. Like the amount of GI issues that I see, and the patient has been seen multiple times, even within a month in the ER for the diverticulitis, Crohn's disease, intractable abdominal pain, which I'm not even sure what that is, but just seeing these patients over and over again, and I think there's a bit of hopelessness in there. They're overwhelmed. They feel like there's nothing they can do. They've had multiple rounds of antibiotics and they know that they are supposed to change their diet, but they don't really know what they're supposed to do. It can be really hard because there is such a knowledge deficit. Even within healthcare, there's a knowledge deficit on nutrition and lifestyle change. A lot of times it's either throughout their visit or at discharge that I try to gauge what their literacy is with nutrition and diet and lifestyle, and even the understanding of their own diagnosis. I kind of take that opportunity, see where they're at. And then for an example, like I had a lady who was being seen for abdominal pain. She had a known diagnosis of diverticulitis and she's at her wit's end. I don't know what I can do. This is my fifth time being in here and I just keep coming back and they're doing the same thing is happening. I asked her, okay, well, what's your favorite food? I'm in Georgia, so everyone likes their fried food. So her favorite food was fried food. And I asked her if she fries stuff at home or if she usually goes out. And she said she does both. And so I asked her, when you're at home and you're frying your food, what are you frying it in? And obviously, fried food isn't the best, but like if I'm trying to offer her a small change within my 5 to 10 minute discharge, I think just being able to educate her on fats and why the oil that you're using can either benefit you or contribute to your issues. So she used Crisco. And so I just pretty much explained to her, like, this is what fat does for your cell membranes. This is how fat can be used well in your body. This is how rancid oils affect your body. Also, just asking her, do you have a Costco membership? I think Costco memberships are expensive, but they're fairly popular. So I just told her, you can get ghee, you can get grass-fed beef tallow, you can get a big bottle of avocado oil at Costco, and it's way more affordable there for the quantity that you're getting. And I told her, if you fry your foods in this, it's going to benefit your body better. Should you reduce your fried food intake? Yes. But start with these small changes. And I have spoken to a couple other patients about same diverticulitis patient. This particular lady was quite overwhelmed and she's crying and I'm discharging her. And clearly she's not feeling confident upon her exit after her visit. And so I actually spent like 30 minutes with her, which is not really realistic for the ER. But thankfully on this particular day, I was working with another nurse. And so she was kind of covering for me a bit, which was gracious of her. But I had to take a moment and acknowledge her spirituality just because I could tell she wasn't really in a place to hear what I was saying. And so I just asked her, we happen to have the same belief system. And so I just asked her, can I pray with you real quick? So we took a moment, we prayed together. I got her to kind of calm down some. I wrote notes on the back of her discharge paperwork. Hey, these are the 3 groups. I want you to try to put fat, protein, and fiber in your meal. Okay. And then she's telling me these vegetables like tear me up. And I was like, okay, have you heard of the FODMAP? Because all of this is super overwhelming, right? So I told her, I was like, I'm going to write this down because unfortunately I cannot meal plan with you right now, but I'm going to write this down on the back of your discharge paperwork. And whenever you're home and you have a moment, I want you to just start looking these things up and focus on these 3 food groups and try to incorporate them. And so is this going to fix her? No, but I think it can help her at least like start on a journey. If she's willing to educate herself and try some small changes, I think it can be a bit more fruitful than just the antibiotics and steroids and pain medication that we gave her. Those are just like 2 examples of how I have like incorporated trying to offer like more education to my patients. I think that since starting the program, even just the first semester, like noticing patterns in patients to be able to also, like, just provide them direction. Like, you're telling me you have all these skin conditions, you have bad heartburn, your skin conditions have been getting worse. You have a specific time frame. Like, you're telling me this has been happening for 7 years, but 3 years ago it got worse. Okay, so we have some specific triggers going on. Now, I'm thinking, what are our mediators that are happening? And so just being able to like offer patients, hey, you can heal from this. It may cost some money. It may cost some extra research. It may take going outside the box, but let me give you a little seed that you can take and grow if you so choose. My coworkers were laughing at me because we had this lady come in for parasites and she showed me this picture of like her bowel movement in the toilet. Yeah. And when I tell you, it looked like Linguini was in this toilet. And she had been seen 3 times in the ER for this. Went to a GI doctor. They gave her antibiotics. It didn't help. She's like literally crying. And all of my coworkers are like, oh, this is up Jessica's alley because we don't have anything for her. I went and met her out in the lobby because she was waiting. And I was like, hey, I know you've been round and round with this. this is my recommendation for you. And I think that this clinic will be able to help you. There are many clinics. You can pick whichever one you want. This is the one that I work at and I can vouch for. But if you don't get the answers that you're looking for, there are solutions. And the funny thing is, go ahead.
No, I just was going to say there's so many good things that you're touching on that I feel like we could unpack here. The first thing that I love that, and this is something that we teach in the program too, is that you're meeting your clients where they're at, right? Like the woman who was eating fried food, you weren't like, listen here, ma'am, you need to stop eating fried food. But rather, hey, I know that you really enjoy eating fried food. Let's just try and make it a little bit healthier. Or this woman who is having the issues with the parasites. Hey, I know that you've been here multiple times. Here's another resource for you. Maybe try that. Even talking about the different food groups and sitting down with your patient and praying with her, meeting her where she's at. And you're like, I don't have all the time in the world to meal prep with you right now. I really wish that I did, but here's some things that you can go look up at home and see if these might help you. And I think that that's something that nurses who are both in our program or maybe who are wanting to sign up for the program, a lot of people I talk to are just burnt out from the Western medicine system of care. And I think a lot of times we think that it has to be an all or nothing, right? We either have to be gung-ho using only functional medicine or we're just going to stay in Western medicine. But I really love how you speak to you're still in your role in the ER and you're helping to incorporate some of that knowledge. And this might be the first time that someone is hearing about different macronutrients, like what's the difference between a fat, a protein, and fiber, or that you're supposed to have that on your plate. And you might be the person who's just introducing to them to that, and then they go home and they start looking it up. And it doesn't have to be this whole 12-week long plan of going on a FODMAP diet, but you're still helping these people by introducing the concept to them while still in your role in the functional medicine world, in an ER, which is like probably the hardest place to try and help people with this information because of how quickly you have to turn over patients.
Yeah. One of the easiest things that I think I do to try to sprinkle in some functional medicine is every time I give a patient an antibiotic, I just say like, hey, with this antibiotic, try to increase your yogurt intake. If you like kombucha, if you like sauerkraut, just try to increase your fermented food intake because this will change the amount of good bacteria in your gut too. And sometimes people have no idea what I'm talking about, but it's okay. Maybe while you're sitting here for hours, you'll look it up.
Right. And even like kind of going on that whole, like keep going on the gut. I keep saying like on this podcast, I'm always like, okay, you're a nurse, you're listening to the Functional Nurse podcast. We're going to talk about gut and we're going to talk about poop. And it is what it is.
Yeah.
But speaking of that, Jessica actually did an elimination diet for herself. So I'd love to hear just like some of the things that as you've been going through it, like what you've learned and how you're going to use some of that knowledge with clients in the future.
Yeah. Honestly, thinking about seeing clients in the future is what convinced me to do it because when I got my GI map back and I got the protocol that was being recommended back, this is going to sound ridiculous, but I'm not going to lie. I like cried for 10 minutes because staples of my diet, caffeine or coffee, like every morning I'm waking up and having a latte with milk. What else was it? I make my own sourdough. I mill my own flour. These staples of my diet, they're telling me that I can't have. And so I'm just thinking to myself, I don't really have symptoms that are that big. I am even on this journey because I have acne and a very like dry, itchy scalp, right? Like that's what's motivating me to do this. And what you're asking of me far outweighs the emotional tax that my skin is costing me. And so it took me 2 months to agree to do the elimination diet. And I just started like every time I started eating something or meal planning, I just started thinking like, okay, if I was going to do this elimination diet, how would I change this? I really had to conceptualize it and try to just imagine it first and make it realistic for me. And so I started the elimination diet, and the first 2 weeks I think it was difficult. The first week I planned for ahead of time. I really planned out breakfast, lunch, and dinner. But then after that it became a bit challenging just because I wasn't as prepared and I'm working. And so I feel like every phase of this elimination diet has been a learning curve, a like journey in and of itself. I keep finding new things that I have to work through, even just emotionally, like why I'm so attached to milk, or like is
Right.
my craving for this because my gut bacteria, because it feeds my gut bacteria, or is it actual an emotional tie that, or routine? And so I would say I'm on the last phase. So I'm on the reintroduction phase, which has been a challenge in and of itself. A part of me just wants to like say, forget it all and just go back to eating everything I love. There's a part of me that feels like I've worked so hard for 16 weeks, or I think it's 13 weeks. I don't want to eat anything because I don't want to jeopardize all the hard work that I've done. But I've felt great. Even not having caffeine as an ER nurse wasn't, in the beginning, I would say it was mostly the routine that was the challenge, not having caffeine. But my energy was fine. I substituted with an herbal tea in the morning, and that became my new routine and was fine for me and sufficed for my comfort warm drink in the morning.
If I could just interrupt you for a second,
Yeah.
Jessica, in case there's anyone on here who's kind of like getting into the functional medicine world, they might not know what is an elimination diet. Tell us, like, what is it? Why'd you do it? Well, you can tell us because of your GI map, but what it, just in simple terms, what is the elimination diet? What did you eliminate? Why did you do this? Just because, there might be someone on here who's just learning about functional medicine and they're like, elimination diet, okay, but what is it? It's kind of like our bread and butter, but for anyone who's
Yeah.
not familiar with it.
Yeah. So I would say an elimination diet is eliminating I think it's the top 6 most like reactive foods. So like dairy, soy, gluten, egg, corn. I don't remember what the other one is. And essentially, it's to reduce the inflammation in your gut. And you also cut out all processed foods. I specifically had histamine producing bacteria. So I had to combine an elimination diet and a low histamine diet, which made it a little complicated. But so you eliminate all of that. For mine was 13 weeks. I don't know if that's like the standard. And essentially it gives your gut time to heal. And I took herbal antimicrobials to try to get rid of the bad bacteria in my gut. And then you take maybe not a lot of, but you do take some herbal supplements to support healing of your gut. A lot of them are a combination. They have like aloe and other stuff in them. And you
Support
can
that, like,
add
stomach, the gut lining, rebuild it up, heal
exactly.
the intestinal permeability.
Exactly. So, and I know we have previously talked about this, but like my GI map, so it showed the bad bacteria and my good bacteria, but you were telling me that you can actually test for like zonulin too, which then kind of proves that you have gut intestinal permeability or increased intestinal permeability. And so, yes, when I first got my lab work done, like a functional panel, we saw all these deficiencies, and I changed my diet. I added some things, I reduced some things, and I started taking some supplements like a B vitamin complex, DHEA, like to supplement some of these things. And then I had my lab work done again 6 months later, and it looked like I wasn't taking anything. It was like all my efforts were useless. And so that's when me and my wellness coach were like, I'm not absorbing anything. And she recommended a GI map from the start. But I was like, let's try to do this like lifestyle change first. And so then after my GI map came back, she was like, yeah, I definitely recommend a GI map. And so that's when I was like, okay, fine, we can do this. And so that's what led me to even do the GI map and then the elimination diet afterwards.
And then you're like, we have to heal my gut so that I can absorb the nutrients that I'm putting into it. And I'm not just wasting a bunch of money on supplements that aren't even being absorbed anyways.
Precisely, which is honestly has become a lot of my advice for people who, everybody is on social media and they see all the advertisements and this thing is going to grow your hair and this thing's going to fix your skin and this thing's going to make you glow, whatever. Yeah, I always tell people like, okay, but at the end of the day, what are you nourishing your body with to start with? And are you even absorbing? Like you could have the perfect diet, but if you're not absorbing any of it, then maybe there's something else going on that's preventing you from absorbing it. And if we target that, then your perfect diet will actually serve your body.
Exactly. This brings up a really good point too, is that we were talking about how do you use functional nursing in Western medicine, We kind of touched on how, which I want to start talking too about, you now found a job in a functional medicine clinic, but also a lot of our students end up enrolling to learn functional medicine because they want to heal their own bodies or they want to help heal their families. Because a lot of times I feel like people find functional medicine because they went to Western medicine to try and find something to heal something themselves or a family member, and it was either just dismissed or it wasn't something that was acute, which we know our healthcare system is great for acute issues, right? If you need some type of a life-saving intervention, by all means. But Western medicine in and of itself just isn't great for preventative medicine, or you know that your body feels unwell, something isn't right, but maybe your labs aren't showing that according to the Western within defined limits. We know that there's an optimal range for labs, and we can see that if you're outside of optimal, what might be happening. But a lot of people, a lot of nurses end up coming into a program because they're like, I need to learn how to heal myself, and I need to learn where do I even get this information from? Because also a lot of functional medicine clinics that are out there, they'll just hand patients like this huge protocol, go and take these 20 supplements and then come back if you have any questions. And it's like, how do you implement that as someone who doesn't even understand? No one took the time to explain to you why you're doing this in the first place, right? And so what do you do in your functional medicine clinic? And how did that process go of trying to find and get into a functional medicine clinic?
And now a quick word about our sponsor, the Institute for Functional Nursing. IFN is the leading education and community platform for nurses bringing functional medicine into their practice. IFN offers everything from short, on-demand contact hour courses to the full functional nursing program designed specifically for nurses and nurse practitioners ready to practice root cause, whole person care. And if you're looking for connection and real-time learning, the Functional Nursing membership includes 4 live meetings every month where we cover case studies and have open discussions and connection. Come be a part of a movement that's redefining what it means to be a nurse. Visit fxnursing.com to learn more and join us. And now back to today's episode.
Yeah, I mean, just working in the ER, I don't think that it's a healthy environment to start with for healthcare workers. You're under lights for 12 hours a day, you're fight or flight for 12 hours a day, you're scarfing food down, you're not chewing. It's not the area for health. And so I just kind of got really fatigued with it and decided I'm going to try to figure out what am I going to do with this education that I'm getting through IFN. So I'm just going to start searching and see what I can find. I'm in Georgia, and so my assumption was that there's nothing near me. I think there's like one, if you drive through Atlanta, I'm just south of Atlanta, there's like these billboards for functional medicine. And like this one, I think it's probably like they have multiple clinics or something. Get your GLP-1s here, get your functional medicine here, your hormone therapy. And so that was the only thing that I knew existed in this area. And I just started looking stuff up, wasn't really finding much. And then one day Indeed popped up and was like, Real Health Medical. And I was like, oh, what is this? And it said like infusion nurse. So, okay, let me look into this. And so I went to their website and I started looking through it. And I was like, oh, well, I'll just apply. It's for part-time. I already work full-time. I don't really want to work full-time and part-time. But if this is a means to get my foot in the door, get some experience, get some more education, actually get kind of hands-on, then we'll just try it, see what happens. What do I have to lose? And so I applied, I went and I interviewed, and there's one MD and he mainly specializes with oncology patients. And then there's multiple PAs and multiple nurse practitioners who work out of the clinic. And so, man, they do a lot. Like even just looking through their website, I was like, I don't even know what some of this is. I had never heard of muscle testing, like energy medicine, there's a wide range of energy medicine, but I think muscle testing is kind of popular in the chiropractic realm. And so learning about that, and then you have your hyperbaric chamber, and then like your infusions, even just the infusions was a big change for me. I had never in my life heard of giving hydrogen peroxide IV. That seemed insane to me. I know. Calcium EDTA for if you have like your stroke patient, and it essentially, is it calcium or no? calcium EDTA, I do believe, binds with heavy metals. And then you have your disodium EDTA, which binds with calcium. So for people who are known to have like clots, it helps reduce your atherosclerosis. I'm still learning a lot. I'm still figuring it out, the amount of stuff that they do. And then they obviously go according, for the IVs, they go according to your lab work and your testing. And then we make your bag according to what are your deficiencies? What are you trying to get from this therapy? Ozone, doing like blood ozone, I was like, what is happening? But then you show up, right? And you start seeing all of these things. And as someone who's only been in Western medicine, as a nurse, you're thinking, this is bonkers. But then they provide you with all of these studies of this is well known. And in fact, we get most of our stuff from other countries because this is prominent in other countries. It's legitimate, like glass
That's
bottles,
awesome.
labeled, expiration dates. It's legit, but we just never hear about it and we don't know about it. We only know, oh, have high cholesterol, you take a statin, you have high blood pressure, you take a,
Beta
hypertension
blocker.
medication.
Yeah. Yep.
Yeah, like we don't know that actually there are other therapies that target the like root cause of these issues along with your diet change and your
Right.
lifestyle change and
Right.
so yeah, it's a lot, but it's been, I would say the patient population there it's a lot different. Patients are looking into the therapies that they're getting. They know about their condition. They're
motivated.
researching about their condition. Yeah, exactly. And it's not like they're not perfect either, right? Like they don't have all of the answers or like all of the education, but they're motivated to learn. And I think that they're really excited that there's a solution. It's not to say that we're curing things, but we're preventing things or stopping things from continuing, if that makes sense. Yeah.
A lot of times our students who are asking questions about what they can do or how to get into a functional medicine clinic, how did you walk into that interview and promote yourself in terms of like, yeah, I work in the ER, but here's why I'm a good fit for this role? Like, how did you promote yourself with then like saying like, I have this additional education, but tell me how that went.
Yeah. So I arranged my resume to really target whole body care or holistic care. My passion is to meet patients where they are and meet them physically, mentally, emotionally, spiritually, which is what we already do. When I'm in the ER, the doctor's there for 5-10 minutes. They walk out and I'm answering all the questions for the patient. I'm holding their hand while they're crying. I'm talking them off the ledge. I'm addressing their physical needs. We already do this. And so writing my resume so that I'm showcasing that this has always been my passion, but I have recognized that functional medicine is a more tangible means of making a long-term impact on patients. I put that I was in the IFN's program and that I had a membership with the IFM. Thanks to IFN. And the nurse practitioner who interviewed me was like, I see that you have a membership with IFM. Like, how did you get that? Or how did you even know about that? And so I just told her, like, oh, I'm in this program and this is what the program is. And this is what I've been learning. And I'm just really excited to be able to work with patients from a lifestyle
And
framework
nutrition perspective. Yeah.
Yeah. Although I'm interviewing for a infusion position, I have all of this knowledge to offer. And I don't know anybody who works with patients and doesn't just casually talk with them, right? Like that's a part of making someone comfortable that you're about to put a needle in their arm is let me distract you from this. Let me ask you about yourself. Let me get to know you a little bit. And being in this family practice realm, you're seeing these patients multiple times. And so you kind of get to build that rapport with them and actually see them get better, hear their stories. I think that's one of the coolest things is hearing people's stories about, oh, I've had cancer for this many years, or I had cancer, but I started doing this and lifestyle change and I went into remission, or I had a brain parasite and I've been doing this and the parasite's gone.
So we were at the American Holistic Nurses Association conference together. when was it? Was it in June? It was like beginning of June, right? And Jessica was our student who won a free admission basically to the conference. So she was there with us, and it was even my first time going to the AHNA conference. And for anyone who doesn't know, when you complete our program, you meet the competencies to take the Holistic Nurse Board Certification, which is under that umbrella of the American Holistic Nurses Association. So we were there. I was running the booth with Bridget, and Jessica was our student who came with us. And it was just such a fun event. And even just being around like-minded nurses, and it was so cool, like seeing all of these different ways that people can heal or ways that we can help
Yeah.
our patients with healing. And so what were your thoughts? Have you been to a conference before, or what are your thoughts about it?
I had been to a conference before. It was like a critical care conference. This was technically my second conference. The first one was through the residency I had done, but yeah, this was definitely different. Even just the classes that were offered it was a wide range, but it was super cool to see your ointments and your compressions or your energy modalities or aromatherapies or psychedelic assisted therapy, like just all the stuff outside the box that like they were offering. I would say that I was super grateful to be going with you guys because you understood me and I was still like in the depths of my elimination diet. And so you guys were so gracious to be like, I think Jessica can eat at this place. And I didn't feel judged for asking 20 questions to the waitress. What oils do you use? What seasonings come on this? You don't even want to go out to eat because you feel like that complicated person. But it was just really cool to be around people who already understood you and didn't think that you were crazy.
Get it. I totally get it. So you took a number of different classes while we were there. So at the conference, they have different educational sessions that you can go to, and you get to pick out which ones basically are like of most interest to you or will serve you the most. So what would you say your favorite like in-person session was?
I think it has to be a tie. The ointments and compressions and the psychedelic assisted therapy were my two favorites. The ointments and compressions was just very interesting because it was very much so that homeopathic, like kind of use what you have in your kitchen to help heal modalities or kind of aid with fevers or whatever it may be. And it was very hands-on. Like she was like cooking it up in there as she was talking with us. And then we all got to try a little ginger compress and a lemon compress. And it was very cool. And that she gave us resources. These are my two most recommended books. So you can learn more. Here's a starting line to educate yourself on this. And then as a veteran, the psychedelic assisted therapy, which is really big in the military and veteran community right now, was very interesting because it was quite scientific based. And they did a really good job of just explaining who's a good candidate for the therapy, what the therapy actually looks like. And it's not an addiction thing. Nobody does it and enjoys it. It very much so is a treatment, and it can be difficult. As they explained, it walks them through their trauma, but from a different perspective than the way that it opens up your neural pathways to kind of be reprogrammed is where the cognitive behavior therapy is really important, which I hadn't heard highlighted much. I had heard a lot of like veterans going to Mexico and getting this treatment in a clinic, being continuously monitored with a sitter at their side. You know, their vitals are being taken. Like it sounded very legitimate. But then afterwards, oh, this is what they experienced. But I hadn't heard much about it's actually really critical for you to receive therapy afterwards, because if some type of trauma happens afterwards, your brain is more malleable and open to that trauma. And so if you're not actually taking the opportunity or the window, I can't remember how long they said the window was, but wherever your brain is in that restructuring phase, like actually doing cognitive behavioral therapy during that so that you are healing is super important. And that was a piece that I had not heard. So those two were probably definitely my favorite takeaways.
That's awesome. And so, okay, so Jessica, what's your plan? So we have one more semester left in the program. Semester 2 is more of like advanced topics where like we go through more pathophysiology, more in depth. We start talking about supplements and lab tests. And once you're done with the program, what's your end goal? Do you have a plan? Do you have a goal? What do you want to do?
Yeah, I'm a little torn right now. I think it would be super great to do like part-time ER and full-time functional medicine. I don't completely know what it looks like. I would say my schedule is kind of more demanding than I prefer right now, but it is a really nice balance between having exposure to what this can be like tangibly. I've never had a desire to prescribe or diagnose, which kind of deters me from NP. Not that I'm completely against it, but I'm not sure I'm ready to take that step. And I think the program does a really good job at just expressing and giving you like the means to dream of not having to have your NP, but how you can actually do this as an RN, whether that's like wellness coaching or taking a role like I'm taking. The clinic that I'm in is small. I'm not sure it is going to end up being a full-time job, but you can still go somewhere, some type of clinic that could be full-time. And so I'm not sure, but I will say that with the balance that I have right now between I'm still very hands-on in the ER and I do enjoy the hands-on part, which is why I like the ER. I just don't like the stress and the fight or flight constantly in the ER.
So much of it, right? Like you're
I know.
incorporating the
Yeah.
knowledge into helping people in the ER. And who knows, maybe your role in the functional medicine clinic could evolve into doing more functional clients on your own, like doing the timeline, the matrix. Maybe once you have the additional training and the supplements and the additional testing, maybe your doc or your nurse practitioners would be like, hey, we want you to start working with some of these more challenging patients with the education that you have. And, that could be an opportunity in the future too.
Yeah, I think if nothing else, it's been a really good networking opportunity. So
Mhm.
meeting practitioners, even the naturopathic doctor that I had coffee with before I even started, just meeting people and getting to know people because needs arise. And as functional medicine grows, the demand is increasing. People's clinics are growing. And so positions are slowly coming open. And so just having that education and taking small steps towards learning more, getting hands-on experience so that if an opportunity arises that I want to take, like I'm prepared. And so I'm thinking, like where I'm at right now is good, but to just continue to grow personally so that if I do see an opportunity to take on more of a functional role, whether it's in the clinic I'm at or another clinic, I can kind of jump and step in and like kind of get more hands-on.
Yeah, for sure. So as we're wrapping up here, is there any advice or recommendations or just words of wisdom that you would have maybe for a nurse practitioner, a nursing professional who's looking into our program, but they're really unsure of how to utilize the information that they're getting, the education? Do you have any advice for them?
I think it honestly just becomes a natural part of your life. I think that what you learn in this program I think you quickly realize that you're actually learning health. And so if it benefits no one else, it benefits you and your family. It's such a trickle down effect. Honestly, the people I educate the most are my coworkers because they see the way I eat. I never take candy from the candy bowl just because I have such a mind shift now towards how is this going to serve my body. And so I really just think that it becomes a part of who you are and your lifestyle. Like once you have this knowledge, you can't unsee it. I want to say even if you do nothing with it, but it's almost impossible to do nothing with it. You can't help but think, am I chewing to applesauce consistency? I'm not sitting down. Oh, I woke up 3 times last night. Is my blood sugar elevated? What time did I eat last night? Instead of just thinking like, oh, I might need to take some melatonin tonight. It's like, I need to pay attention to what time I eat tonight and what I'm eating.
Right. It's not like a restrictive thing. And I feel like a lot of times people can think that being healthy, you have to like restrict things. It's just a different way of thinking. It's a different perspective of, for example, the candy in the candy jar is, okay, but I'm going to eat this and I haven't had any like protein or fiber before I ate it. So this is going to spike my blood sugar. And then my insulin's going to spike. And then I'm going to crash and I'm going to be really tired. And then I'm going to go reach for some kind of caffeine because my blood sugar is low, or I'm going to go get some carbs or something. And it's just like a spiral. And you're like, is it really worth it? And sometimes, yeah, it is. But most of the time it's like, okay, but is this really serving my body? Is this adding years or taking away?
Yeah. I wanted to say one more thing too, Sam, if I can.
Yeah. Yeah.
Because I was talking to you and Bridget about this at the holistic nursing conference, and I think that where functional medicine, from my humble opinion, really needs to go is the veteran and military community. Like, if anyone has family who is in or has been in the military, you already know that they're constantly in fight or flight. They're never sleeping. They eat insanely fast. Their exposure is through the roof, whether that's jet fuel, mold, cleaner, random super strong cleaners. Like, the lifestyle that you live in the military is completely opposite to everything that our body requires. And so, like I was mentioning, the psychedelic therapy for PTSD, or I know hormone therapy is really big right now in the veteran community, but I think that what people don't pay attention to is your body actually has a means of producing hormones. And a lot of times, especially I think in the veteran community, because of your constant fight or flight and your poor gut habits, you don't realize that there's a lot of healing that you can do before seeking out hormone therapy. Not to say that we don't need it, but addressing your lifestyle habits and unlearning a lot of the things that are ingrained in you in the military, I think can be life altering for our community. If you got family and friends that are in the military, recommending that they see a functional provider and looking into some of the lifestyle changes can be really helpful.
Definitely. We actually at IFM and at AHNA, there were different military people who would stop at our booth. And it sounds like there's a lot of different people who are involved in programs within the VA in different states who are working to try and like health with our veterans. And so I think
Yeah.
that as this is becoming more well known, that implementing this, and I've heard in the past that the veterans in the VA tends to be a test group almost first. And I think that if we see positive results here, that it's like, okay, this needs to be done everywhere.
Yeah, yeah. I know some VAs do offer some. I know a lot of the people at the conference, the Healing Touch group had worked in VAs. I worked at the Houston VA, and I know they had Healing Touch there as well. But yeah, just the knowledge. Once you start learning, it's really such a snowball effect, even in your own life. Really, I don't know how you avoid it.
For sure. Well, thank you so much for sitting down with me today, Jessica. It was so nice just seeing you again. I know we were together for a couple of days in Niagara Falls, and we went to go see the falls, and we drove over to Canada, and we had some, what kind of food was it? It was like a Japan barbecue restaurant.
Yeah, yakiniku. Yeah.
Yeah, that was good. It was just like such a cool experience to be there with you and just to meet another one of our students, but also a nurse who's like-minded and someone who's actually thinking about what they're putting in their body. How does this impact your body? And that's something too that I always try and tell to people who are considering joining the program is that when you join the program, we have our community, and it's all nurses who are nursing professionals who have the same mindset, right? That we want to be able to improve in a different way and to improve knowledge of the ways that we can do this. And I just think that it's so cool to be around like-minded people.
Yeah, it's like iron sharpening iron, right? Like in the meetups, in the community groups, people just, hey, I have this client. These are all the things I've done. What am I not seeing?
Right.
And people just being able to call out your blind spots, or in the meetups, whether it's the student presentations of this is the client I'm having, or whether it's one of the faculty presenting a client, and then just getting our wheels turning and helping to shape our pattern recognition, or just reshape how our brain thinks from that traditional education in the Western realm, which is still useful, but it's really nice to be able to actually kind of put it to work and see a different way to address things.
Have those conversations with other people and to have those opportunities to take what you're learning and then apply it. And within each module, we do have case studies. But it's nice to do it in person where we'll have a student-led case study or we'll have a faculty-led case study And then it's just an open discussion of, okay, what would you do here? What did you do here? What supplement? What test? And one time it was even, okay, but as an RN, how did you help that client get that test?
Yeah.
And then talking about the different ways that people can get testing or supplements is just, it's helpful because it's not really out there unless you're learning it from someone else.
Yeah. And learning it from like trustworthy sources. All of IFN's modules has studies attached to it. And so I think there's a lot of stuff out there that it's almost like just because it's on social media, you're not sure if you should trust it. And so being able to like receive valuable information from trusted resources that are backed by research that's at the ready for you to receive, and you can actually look it up for yourself and read it.
And trusted individuals too, right? All of our faculty members are all IFMCP certified. They're all practicing in functional medicine. You know that when you're having this conversation with somebody and you're going over this case study, it's somebody that is trusted and valued and has the knowledge to listen to them. When you're learning at the bedside and you have a preceptor, and there's that one preceptor that's really good that everyone wants to work with. But then you have the ones that are kind of like, I don't know if I don't trust what you're telling me. I need to go look this up on my own. All of our faculty members they're experts in their field. Yes, you can take what they're saying and directly apply it, but they'll be like, oh yeah, no, it's right here. Here's the resource for it. It's so great being surrounded by such highly educated people in this very specific area.
Yeah, and they've been nursing for years.
Yeah.
And they're still motivated. If anything, I'm like, are you more motivated than when you started? Because you're really excited about this. And even in just the presentations, I hate when people just read off the slides. And so it's really nice the way that the modules are presented because they're covering everything, but they're sharing their experience and they're sharing how they've seen this clinically present and how it can be a little deceiving sometimes, but this is how they've seen it show up and how these patterns can present, even if it's not that picture perfect pattern.
It's like when you were in nursing school and you could look at the slides, but going to class, you get so much more out of it because your instructor or your faculty member is not only reading off the slide, but speaking to it and elaborating. And that's where you're taking notes. And that's what happens in the modules is that, yeah, you have the slide, but you're also listening to what they're saying and then taking those notes of, oh, that's really good. That's a really good slide on here. Exactly.
Yes. Thank you.
You're welcome. Well, thank you so much. I appreciate your time, Jessica. It's been wonderful talking with you. And I'm so happy to see you again.
Thank you so much, Sam. This has been a pleasure.
You're welcome. Thank you.
Thank you for tuning in to the Functional Nurse Podcast. If today's episode resonated with you, be sure to subscribe and leave a review. It helps other nurses find this movement. To learn more about our programs and join the community at IFN, visit fxnursing.com. Together, we're not just rethinking healthcare, we are rebuilding it from the inside out.